I think people need to remember that most of these supplements have really great marketing teams behind them, which is not wrong. Of course, they should be marketing their supplement to get it to you. But some of the claims and some of the ways they want you to feel when watching the advertisements, it's important. So I think about that too. As someone who's been on both sides, I think, okay, well, what are they wanting me to feel? But then also, do I need this? And is the value of it sustainable?
Welcome to MythBarkers, where we make pet parenting easier by sniffing out the facts and debunking dog tales.
We are so excited about today's episode, as a lot of pet parents have already told us that health and wellness is an area they'd like to learn more about. So today we're going to talk about supplements. Laura, if you can introduce our lovely guest today.
Of course, our guest today is a doctor of veterinary medicine. She's also a certified veterinary acupuncturist, a canine rehabilitation therapist, and a peaceful end-of-life practitioner. Her goal is to improve the health and longevity of our pets through holistic medicine, with a focus on empowering pet parents to become medical advocates for their pets, which just aligns perfectly with what we're trying to do with MythBarkers and make pet parenting easier and help our dogs live the best lives possible. So without further ado, let's welcome Dr. Angie Krause to MythBarkers.
Thank you so much for having me. I'm excited to be here.
Thank you so much for joining us. We're curious how you got into this field.
Well, when I was 3, my mother brought home 2 kittens from the Humane Society, and they were black kittens. And I got one and my sister got one. And naturally, I named my kitten Pinky, since that was my favorite color. And then we took Pinky to the vet. And when I walked in, I was like, this is it. I'm home. This is what I'm doing.
3.
At
Wow.
3. Yes. So that's how it all began, with Pinky. And Pinky turned out to be a boy as well. We thought Pinky was a girl. And so we can thank Pinky for my career.
This is amazing. And that was such an early age to realize your aha moment.
Yes, it was very early. I feel very lucky because there was never like, well, what am I going to be? Or when I, went to college, or all those decisions were made. So it made part of my life really easy.
So aside from the traditional veterinarian medicine, Western medicine, is there a specific reason or inspiration for you shifting also to holistic medicine?
Yes. So when I was 17, I got mono, like a lot of 17-year-olds do.
Been there.
Yes. And then I just didn't get better. And I was tired. And I was probably tired for a couple of years. And at that time, so this was the late 90s, they just said, yeah, you probably have chronic fatigue syndrome. You're going to be tired for the rest of your life. And that was terrifying, as a then 19-year-old. I was like, how am I going to be tired for the rest of my life? And so I used nutrition and Chinese medicine, and I changed my diet, and it changed everything for me. And so even going through vet school, I always had an eye on an integrative approach. And so I pretty much came out of vet school. I was doing rehabilitation at the time, and I learned Chinese medicine, and I became very interested in an integrative approach, because sometimes Western medicine doesn't have the answers. They might be able to find a pretty good diagnosis, and sometimes it's a really good treatment option, but not always. It's not the whole picture.
I also love that, the holistic approach has a lot of preventative aspects. So rather than waiting for the illness to appear and then fixing it, it's like, how can we live a lifestyle where we prevent those things from even happening, so we don't have to deal with it at all?
Yes, absolutely.
So today we want to talk about all the things that we give our dogs to keep them healthy, or to make them healthy. And we want to really focus on supplements. And it feels like there's new pet health brands and supplements popping up almost every day. And I think it's a lot for any pet parent to try to understand what's actually real, what's going to help, what's not, what's necessary, what's not, all that kind of stuff. So we want to get to the bottom of that and understand your perspective. So in general, how do you guide people when you're talking about supplements with your clients?
Yes. Well, I've been doing house calls for a long time. I'm in a clinic now too. But what people present to me when I'm in their living room is they bring out a basket of supplements and they're like, oh, I was at the
Guilty.
pet food store. Or, I mean, Instagram and TikTok are like perfect. Some of these brands, their marketing is so good that I'm like, oh, yeah, all my clients are using this, supplement. And unfortunately, most of it's not that great. Probably that's not a surprise. And what I see as I've been able to be involved in designing supplements, a lot of supplements just don't have the potency. They'll say like, oh, it has ginger or some mushroom or something. And then you look at the actual amount of herb or supplement in the chew and you're like, that's nothing. And so I think that's where most people get into trouble, is that they have like 10 things. And then their dog is like, I'm not eating this. Like, you do reach a threshold where most dogs will say, okay, this is like more supplement than there is food in my bowl. No, thank you. And so I really try to help people look at the evidence, and I combine that with what I find to be effective in practice. And I try to just pick like the top 3, maybe 4 supplements, but I really try to focus more on diet.
Yes. So before this call, Laura and I had this quick discussion about if dog food was already balanced, then we wouldn't need any supplements. But the regular pet parent doesn't know how to read beyond the ingredients on the list. How do we know if the dogs are getting their essential vitamins and minerals?
Yes, and you shouldn't have to. And there's not quite enough information on the bag. So what you want to look for is you want it to say on the bag, balanced by AAFCO standards. And so AAFCO basically has a body of information where we look at minimums and maximums. And it comes under a lot of fire, especially around like the holistic community. And I guess what I say to that is that we still have information, and I'm not throwing that information away. I probably have it on my shelf somewhere here, but it's this huge book of all these studies we've done. And I'm a big fan of information and well-designed studies. And so if I know the minimum of this, vitamin or mineral is this, I still think we should use it. There are a few minerals in there that people get really like, well, I don't like their zinc, and that's fine. And people can pick at that. But what you want to do is make sure that it's balanced by AAFCO standards. That's just the minimum. And for the most part, they do a pretty good job. And just here's a little secret. I've been working in the pet food industry for a long time. Most pet foods have been formulated by approximately 3 companies, and everyone's formulating with the same information using the same set of software. And so if you're balancing things by AAFCO standards, it's probably fine in the sense that we're meeting some minimums and we're not exceeding some maximums.
But do you think then that that's the larger question at hand? We might not need all these supplements if the food provided more of those nutrients that are needed, right? It seems like we're missing something here.
Right, because what is not in food, which it's really hard to get medicinal stuff into food with all the regulatory bodies. Like we couldn't like throw CBD into food because of the way things are regulated. So when we start talking about adding herbs and other things in there, you really can't. The other reason why our food isn't more functional in the pet food industry is the cost. Like if you wanted to have a functional amount of anything in there, you're going to pay for that. And that becomes really costly. And then, so, we're calculating the cost of shelf space and then the formulation. And then you add on top of it, what will the pets eat? So pet food companies go through all these palatability studies. And so it gets quite complicated. And so I think the pet food industry is doing the best they can. And they are moving more towards functional diets. And think what you might about prescription diets. I have a lot of opinions about them, but they are starting to move towards that those functional ingredients. And so hopefully we'll see that kind of trickle down. And so if you take an animal that is maybe anxious with joint pain, they are putting L-theanine in diets to help increase serotonin, and they are putting glucosamine in higher fish oils. So the pet food industry is trying to be more functional, but at the end of the day, that's why we have supplements too.
That is so fascinating that we have the illusion of vast choice, but as you said, there are three key companies that create them. So it's just a lot of different packaging, but
Yep.
based on the same research. I'm gonna have to look more into this. So
Yeah.
what percentage of the items that are out there do you think are approved by AFCO?
The majority.
Okay,
The majority.
that's good.
Yes.
That's good.
But looking at supplements, then, like, there's so many options, right? And I am guilty of doing this because I feel like I see something and I'm like, oh, I want to help their digestion, or do they need a probiotic? Oh, dental health. I'm probably not brushing their teeth as much as I need to. So let's give them a supplement for that. Oh, coat health, immune system, vision. I mean, I've
Yeah.
tried all of these things, and there's so many different types in the formulas. And like, I'd love to understand from you, like, how do you guide people? What's the most important and what's going to be the most effective as it relates to types of supplements, but also like the format? Because I know there's like chews,
Right.
powders.
Chews are never going to have the potency. And sometimes chews are important as a delivery mechanism because some dogs are just like, don't put a powder on my food, but I will eat this stinky chew.
Yep.
And so from a cost perspective, I always look at chews and think, oh, wow, to get that therapeutic dose that I'm looking for, this is like an investment.
Yeah.
And so that's why I really just try to do less supplements whenever possible. And I think people need to remember that most of these supplements have really great marketing teams behind them, which is not wrong. Of course, they should be marketing their supplement to get it to you. But some of the claims and some of the ways they want you to feel when watching the advertisements, it's important. So I think about that too. As someone who's been on both sides, I think, okay, well, what are they wanting me to feel? But then also, do I need this?
Right.
And is the value of it, is it going to be important, and is it sustainable? So when we think about like doing a joint supplement, if you're going to give chondroitin and glucosamine and you're going to give it for 1 month and never give it again, it's probably not that helpful. We know that those supplements are a better preventative than they are treatment. And so a lot of people start using them after, their dog has symptoms, which they still should, but it was going to be better before. So if you have a dog and you're like, okay, my dog is 2 and I want to put this dog on joint supplements, maybe it's a lab, and so we know they're more prone to arthritis. You have to look at that and say, okay, can I do this for years upon years? And if you can't, just put it down or don't put it in the cart. Don't put it in the TikTok shop. Just don't do it. Now, if your pet's having diarrhea because they just had antibiotics and you're like, okay, I'm going to give them some probiotics, I think that's a time where it's okay to say, okay, for the next month or 2, I'm going to give this course of probiotics. But you really have to think about what you're trying to prevent, the potency of it. And then, is your dog really going to take this? Or like, are you going to have to pill them every day to get this supplement down them? So I think there's a lot of things to consider when you're picking them out.
So you had mentioned that you would recommend average 3 to 4 supplements for dogs. And of course, every dog is different based on breed, lifestyle, the individual dog themselves. What do you think are the 3 and 4 most important supplements that overall are helpful to dogs?
I would say fish oil is one. Great anti-inflammatory. Just great for everything. As long as your dog is not sensitive to fish and doesn't have a history of pancreatitis, fish oil for everybody. The second is a probiotic. And I really am a big fan of rotating probiotics. And so I have 3 brands that I rotate between so that we're getting like a single strain and a multi-strain and soil-based and not soil-based, because variety is really the key to the microbiome.
Oh, that's so fascinating.
And so I just keep rotating through.
Gotcha.
And then for my third, if I were to pick out my third and favorite, I would do either a CBD, like hemp extract, or mushroom. If I could have both, I would do both. And CBD and mushrooms, this plant medicine is a little pricey. So if you have like 2 70-pound dogs, then you probably want to pick one.
Yeah.
Yes.
What's so interesting, besides for the probiotic, you name individual types of supplements or individual types of products. You're not saying a digestion or a this or that. Do you think single ingredient foods are the way to go and single ingredient supplements? Are they from a potency, from an impact perspective?
Probably. I would say most of the formulations I've seen, I mean, I use a couple digestive aids that have several different things. They're in a powder. Yeah, I mean, I really try to keep it simple. And so if we were talking about the average dog, I would say those would be like, that's A plus plus. I know for me, just in full disclosure, that I could not do that right now. Like, I could give my dog fish oil, but I know I'm not going to get out the CBD and the mushrooms and the probiotic every day. And so then I have to think about that unless there was a problem, because you have to think about how complicated can you make mealtime. Some people are like, nope, I have my regimen, but like I'm struggling to take my own supplements every day. And so like I would have to think about, okay, this is how small I want to keep it. But yes, I usually like to use single ingredients when I can, but there are some great calming chews that have like L-theanine and ashwagandha and some other things. I just try to keep it really simple.
Simple is key because then we can actually follow through with it every day
Yes.
and be consistent.
Yes.
I think that's a very under talked about aspect of nutrition. So for things like fish oil, I try to take it on a daily basis. Are there certain brands, like human supplement brands, for example? Can my dog have that if that's a single ingredient omega-3 capsule, or is there a huge difference between the supplements that people take and the ones that dogs take?
There's not a huge difference.
Oh,
It's
fascinating.
the same. As long as there's not any like xylitol or anything toxic to dogs for flavoring, yes, you can absolutely share your omegas with your dog.
And so if we're thinking about the dosage, that would be when we approach you for like a consultation to navigate how much I should give my dog based on their weight, maybe
Right.
based on their breed. Can you talk us through a little bit of that process?
Yes. So I always think about the weight of my patient, but then I think about their digestive status. Because so you're taking fish oil when you can remember. And sometimes it can be upsetting to the stomach. It can make you like burp fish oil. And so we imagine like that's the same for our dog friends too. And so I think about, do they have a lot of problems with their digestion? Are they sensitive? With fish oil, I always start in really small doses and work up to tolerance. Some people do really high doses, like several thousand a day. I would definitely work with your veterinarian if that is the case. I mean, sometimes it's warranted and it's helpful, but usually, like for a 50-pound dog, I'm going to try to keep it to 500 milligrams of EPA and DHA as kind of a starting place and then work up. And some dogs are really sensitive. It'll give them diarrhea. Some dogs just have guts of steel. Like you could put anything in there and it's completely fine. And so you just have to know, like, does your dog have a history of pancreatitis? Are they sensitive to fat? Some dogs just look at new food and get diarrhea. And so you kind of have to know what you're dealing with there.
I think my rescue Jindo is the opposite because even though I give him probiotics and all these like supplements and I try to keep his food balanced between wet and dry, every single time when he goes to the bathroom, he screams because the start of his poo is really hard and then it gets looser. But I don't know how to solve it, so I'm on a mission to figure out how can I balance his diet so that he doesn't scream every time he poops.
No,
Poor baby.
yes. Maybe have you done like any of those bulk laxatives like the psyllium or
I've never tried it, but I do have psyllium husk at home.
Yeah.
So maybe that's something I explore.
Yeah, you might try that and see
Okay.
if that helps soften things up.
Luke, thanks you.
So you mentioned consistency and how important it is. How long do you recommend that supplements are given before even you expect to notice a difference?
Yes, it really depends on what supplement, but something like for the dental supplements, unfortunately, all the tartar on your dog's teeth, it's not going to come off with that. And that's the part where I wish they would tell you that there's way better to help prevent new tartar bonds from forming. But once your dog has tartar, it's really hard to get it off with anything besides manual removal.
Scaling.
So, yeah. But with something like a probiotic, probiotics can sometimes take months to work. The
Oh.
more information we get about the microbiome, the more we understand that probiotics are a really long-term game. Even just for a dog with a sensitive stomach, it can take, 4 to 5 months for you to see maximum benefit.
Wow.
And for most of my career, I think I've had times where I give up on probiotics. If after a couple of weeks they're not working, I think, okay, well, that's not going to work for my patient. I move on to the next treatment. But now we're finding like, oh no, you really have to stick with it, which can be hard.
I mean,
Yeah.
it's good to hear because some people might start and think that it's not working.
Yes.
But to know that we have to have patience and, give it at least 6 months to see meaningful change, at least there's a destination that we're working towards, and it's
That's
not
right.
like darkness.
Yep. Don't stop.
Well, and in the instant gratification era that we're in, right? And not all of us have that patience or that realistic expectation that it's going to take that long. So I love that we're talking about this to say, no, you have to be consistent and be patient to see the change.
I think there's so much we don't know about the microbiome, and we're still trying to figure out, okay, well, what does a healthy dog's microbiome look like? And that's still a little bit of the unknown, and that's what we're working on. And, giving lactobacillus maybe isn't the best for any given dog, but maybe it's the best for one individual dog. And so I would say my results with probiotics vary greatly, and there's so many different bacteria and yeast on the market that it's hard to know. I think we'll come to a time in our lifetime where we're having individually tailored probiotic recipes for ourselves and our dogs.
I'm excited for this because I have gut issues. Are there situations where giving our pets too many supplements create adverse effects?
Absolutely. There is a body of evidence that is emerging with people where we're realizing that some of these really high dose supplements can actually be carcinogenic. And so I'm sure that is the same for dogs as well. So maybe they're thinking like, okay, well, maybe too much vitamin C is actually not good for you. One thing I will say that I see often in dogs is that people will take on supplementing something like vitamin D themselves, and that can be problematic because it's fat soluble. So you can actually get too much vitamin D. And so there is a point in which vitamins and minerals can become too much.
Wow, I had no idea. That is real news because, pet parents really want to do the most for their pets. And I think this overzealous sort of like, I want to give you love and make sure you have everything can then show up in the wrong ways if it's done excessively. So this is a really great piece of information to relay to our listeners.
Moderation is key.
It's always key.
It's hard though, understanding, I think, even like what these supplements are, what the ingredients are intended to do. That's something that I would love for it to become more widely known. I had a similar health issue that you. I have Epstein-Barr and fibromyalgia, chronic fatigue as a teenager. And so learning what's anti-inflammatory, an anti-inflammatory diet versus an inflammatory diet, like certain things, and understanding what the immune's response, like that's a lot of information for a lot of people to learn. But I'd love to get that information more widely known because I just think it could benefit so many people.
I agree. And I think one thing that supplements can't do is make up for a diet that's not appropriate for the dog. So I see that a lot where for whatever reason, maybe there's an allergen in there, maybe the food isn't that great of quality, maybe it's not the right diet for that dog. There's not enough supplements in the world that can make up. Just like you and I with our chronic fatigue, we were not going to supplement our way out. Like you have to change your diet. There's just no way around it. And so we're marketed these supplements as if they're going to be a quick fix. And it's just unfortunately hardly ever the case. I love it when it is, but it's hardly the case.
If we've learned anything from this podcast, it's that everything takes time. And the most meaningful change comes from patience. So this seems to be right along with that theme. So when you're looking at dog food, are there certain things that you look for in the label and certain red flags that you try to identify before you purchase or recommend dog food to your clients?
Yes. So when I'm thinking about what my patient should be eating, the first thing we have to think of is like, what's the lifestyle? What can people do? What are they willing to do? Not everyone wants to home cook. Not everyone can afford a commercially prepared raw diet for their 150 pounds of dog in their house.
Right.
And, where do they shop? What part of the country do they live in? So I think about all of those things, what the budget is. And then I think about the needs of the dogs. Some dogs are never going to eat a commercially prepared raw diet. It's never going to happen. And so we think about like their own preference. I really believe that dogs should enjoy their food. I think it's just like a right that they should have to enjoy food. It's just a great pleasure of life. And so I take all of that information, and of course, my favorite is the least processed. I love the commercially prepared, balanced raw foods. I love now there's a growing segment of the market where they're doing fresh, frozen, basically where they cook food and then it comes in these lovely little, I don't know if either one of you feed those, but there's all these brands exploding. I think those are great too. I think they feel good to feed because you're like, oh, I would eat that.
Yeah.
And food is love. And so that just feels really good. But at the end of the day, a lot of people that hire me have a lot of dogs. And so maybe they're doing a kibble and they're doing some of those diets as toppers. Or, maybe we're doing kibble, but we're putting on a hard-boiled egg and some blueberries. And so I think there are a lot of ways to reach the point where we're feeding the optimal diet. And there's so many things to consider for every individual person.
Makes sense.
How do you know if a diet is not working for a dog? Are there any general signs that dog parents that are listening and watching could look out for?
Yes. I would say the number one thing is dogs that get repeat ear infections, that are scooting, that are scratching, that have hot spots. Usually there's some part of the diet that's not working, not always. Usually there's some type of food allergy, food sensitivity. Dogs that are like belching a lot, maybe vomit intermittently, maybe they're stools, like their poops are just never quite right. Or the really gassy dogs. Some people are like, oh, my dog's just gassy. And I think, oh, we probably could help that.
It's like, it's a cute personality trait. What are you talking about?
Like, no, the dog is actually uncomfortable. We should fix that right
Right.
now.
Yeah. Let's make a change. Or if your dog's pooping 5 times a day and isn't a puppy, there's probably too much fiber there. And we should think about how much, nutrition they're actually absorbing. If there's that much fiber there.
I didn't think about that. Too many poops for an adult dog is concerning. That's a good one. Yeah.
Yep.
So when we're approaching dog wellness from a holistic preventative point of view, what are some of the things that you wish that pet parents knew upon, either adopting a puppy or getting a young dog? What are some things that you want them to know to set their pets up for success?
I think one thing, if you're holistically minded, there's a little anxiety that comes in with people like us because we've had our own health concerns. And so there's this way we want to do everything right. So there's a little anxiety that comes in that no one really talks about, but I deal with every day in my practice, the way that we feel responsible and want to make sure every ingredient is perfect and every diet is perfect. And I think there's something to be said for enjoying your dog and letting your dog enjoy their life, even if they might have a symptom or two. I think it's an overlooked part of an integrative approach. And, is your dog getting enough exercise? Are you happy? Are they happy? And so I always like to make a plug for that. And I would say if we were to get really practical, if you take care of your dog's teeth and you feed them the best food that you can, that's most of it right there.
Yeah.
That's great advice.
Yeah.
That's great advice. And the dental health is, at least for me, I learned about it really late in my dog's life. And so I had regrets about not being able to brush their teeth or training them to be okay with that. So then I had to explore all sorts of other methods like putting gauze and then like brushing them manually. But it seems like that is an area that is not discussed often in pet health that is extremely crucial.
It really is. And it's okay if you can't brush your dog's teeth every day. Most people can't. The next best thing is to look in their mouth once a week and just get an idea of what's going on in there. And then after that, when they need cleanings, it's okay to put them under anesthesia. If your vet is doing quality anesthesia and the protocols are up to date, then it's actually better for them to have that and then to have a clean mouth that isn't constantly seeding inflammation into the blood. And so I think that is probably, I know I have a cat joining us.
This is absolutely amazing. I was wondering, I was like, what's happening?
Just a cat tail.
By the way, we love animal interruptions on this show.
Yeah.
It happens regularly over here.
Okay, so if we can have them get proper like cleaning under anesthesia, that is the most effective.
It's most effective. And it's okay. Like you are actually doing the best thing because you're cleaning under the gums. And come here, Fritz. Just get all the way in here.
It's just
Oh,
so
now we got to see his face too. See the rest of the
This
cutie
is
pie.
Fritz.
Oh,
my
hello,
God,
Fritz.
what a beauty!
He's the one that's behind me in this picture.
Oh,
It's my son.
Okay, photogenic as well. We love it.
Photogenic, totally. And so I think this idea that we have to brush their teeth every day to be taking good care of their mouths, that's not what it equates to. But if your veterinarian's like, we really need to, get your dog's teeth cleaned, I would do it.
Do you feel that dental sticks are effective at all, or do you feel like that's more of a marketing thing?
I think they're effective a little bit.
Okay.
And so I wish they were more effective. I mean,
Mm.
I think they're worth doing, but I think the benefits can be exaggerated.
Gotcha.
What I really like about them is that they make people think about their dog's oral health. And so that habit, so when people are like, oh, I give my dog a dental treat every day, I'm not mad at that because every day you're thinking about your dog's mouth every
Yeah.
time you do that. And there's a ritual there and it's in your consciousness and it helps a little bit. And so it's not hurting and it's possibly helping. I like the ritual of it.
but like that should not be the only thing that you're doing.
Correct.
In terms of oral health. Are there any things that you would recommend that we flat out avoid? And I ask this because I learned a few years back that, dogs chewing on sticks is seemingly normal, but actually potentially dangerous with the splintering.
Right.
I had to get some of my dog's teeth extracted. Are there things that you would say avoid these as pet parents?
Yes, this is controversial as a holistic veterinarian, but raw bones. I hate them because I remove so many teeth that have been fractured by them. Most dogs are not responsible chewers. Some are. So I have to give those credit, hashtag not all dogs.
Yeah.
But I see so many dogs fracture. In fact, I even have a tooth model. I'll show you because I feel like everyone should know this. Okay, so this is a...
This is gold.
Oh, I love this.
Yes. So this tooth right here gets a slab fracture. So there's a slab that comes off. And what happens is then bacteria can get into the root. So the tooth looks okay besides the fact that it looks a little fractured. But what happens is it abscesses. So you can see the root. So this is a 3-rooted tooth up here. And then it abscesses and it's really painful. And your dog's never going to show any symptoms. I can't tell you how many of these I find. It's another reason to clean your dog's teeth under anesthesia because we're taking x-rays and then so we can see that abscess that would have caused us to call our dentist in the middle of the night because it's so painful. And so I hate bones for that reason because I've seen them cause so much pain. And sticks, oh my gosh, sticks are so hard. I just saw a lab yesterday morning and he's 7 and she's like, Angie, he carries around like trees, like small trees. And we were talking about it and we agreed that just regular oral exams were how we were going to treat him because it's part of his life.
Yeah.
And it's part of his joy. And so I was like, okay, we're not going to try to take his joy away, but we're going to be really diligent in looking in his mouth so that we can see the teeth and take them out if we need to. But I just couldn't bring myself to recommend that this guy never pick up a giant branch again.
Was he in the room looking at you with those eyes? Is that why?
Yes. And then all I could think about is veterinarians. Sometimes we make these recommendations that are absolutely ridiculous. Like there's no way anyone could ever do them. And I'm like, this dog he's 7. He's been carrying around branches his whole life. It's not going to change now. Like, can you imagine the training it would take? Like, it would take the joy out of existence outside. And I wasn't willing to do that. So we made a plan to still care for his oral health in a way that he could be on board with.
I love that.
I think this is a great approach, because like you said, the quality of life for them is the reason why we're looking after their health and wellness. And if they can't have fun, it's like, I'd feel really, really bad that he can't have that much fun with the thing he loves the most.
Right. Yes.
Being a a holistic veterinarian, how do you balance kind of more Western approaches and treatment with the holistic modalities? How do you balance the two?
I would say there are two ways. So it really depends on who I'm working for. Some people are like really trying to keep it as natural as possible, and trying to do as like minimal vaccines. Some people are like, actually, if there's a vaccine to prevent anything, I want to do it. So a lot of it's client dependent. And then a lot of it is I just do what works. And so, like, there are moments where Chinese medicine is the superstar. And there are other moments where Western medicine's pretty good. There are things we just get to fix with Western medicine. And so I just take the approach that, you know, whatever works. And oftentimes it's a little bit of both.
Yeah, I think it's so great to have both of those sets of information and techniques to draw from because like you said, everything is case by case and something might just be better if it was natural and like no need to get extra chemicals in there, but sometimes drastic measures need to be taken that can only be done with the Western medicine techniques.
It's true. Yeah, it's
Yeah.
true.
It must be really good to have both.
I love having both. I could not imagine practicing any other way.
Yeah.
Do you think this is the future of veterinary medicine? Are you seeing it become more popular? Because I haven't seen too many. We're up in the Northeast. I'm in Connecticut. Yena's in New York. I would love a more holistic approach for my dog's health.
I would say yes and no. There are some things that I've watched over the last 20 years get woven into traditional medicine that wasn't so traditional. One of those things is acupuncture. A lot of traditional vets will learn acupuncture and they might not learn the Chinese version of it, but they're learning kind of more of a Western version, but that's okay. You're still probably getting to the same point. You just aren't thinking about the Chinese medicine aspect. Another thing that's becoming more mainstream with veterinarians is CBD. Like I was really proud of my profession at how quickly everyone jumped on the hemp extract cannabis bandwagon. And so I think there are little areas that get woven in that would have been not part of the fabric 20 years ago.
Yeah.
But overall, I think the problem that veterinarians have integrating holistic approaches of Chinese medicine, homeopathy, is that it's kind of a lot. And so even if you're just a small animal practitioner like me and you've got dogs and cats, it's a lot to keep up on because you're like, I'm the dentist and the ophthalmologist and the cardiologist. And so I think a lot of veterinarians just get to the point where they're like, okay, I know what I know.
Dr. Angie, you've shared so much about how pet parents can learn how to approach not only their pet's diet, but also supplements what's going to be most beneficial for them and how you bring Western and more traditional practices together, which is so impressive. If any of our listeners wanted to learn more, how do you work with clients and where could they learn more about what you offer?
Yeah, so you can go to boulderholisticvet.com and I offer online consultations. So I might not be able to prescribe your pet medications, but I can help get you organized. I can look at all of your dog's medical records and help you create a holistic plan.
Absolutely love this resource for everybody and hope that we can provide the platform for them to learn, dip their toes, and then get interested and really find a meaningful solution for their dog. Thank you so much, Dr. Angie Krause, for coming on our show and enlightening us. We are so excited to share your knowledge with our audience.
Thank you so much. This is so fun.
That was so much fun, and we also learned so much. For everyone who's joining, you can follow Dr. Angie Krause at Boulder Holistic Vet on Instagram. You can also go to boulderholisticvet.com to find more information on her services, her digital courses, etc. Thanks to everyone for tuning in, and stay tuned for our next episode of MythBarkers next week.